So in the previous session, we have seen this part. In the previous session, we have seen general consideration regarding antimicrobial drugs. What are the different targets for antimicrobial drugs? Different terms related to antibiotic therapy, etc., etc. We have seen different targets. We have also seen the class history, some historical points, then classification also. We have seen these points. We have seen the classification also. There are different ways to classify the antibacterial drugs. We have seen that, and today we are going to see about the sulfa drugs, sulfonamides, and quinolone antibiotics. We have seen different classification depending upon the chemical structure, depending upon the therapeutic uses, depending upon the spectrum of activity, depending upon the clinical classifications. There are different way to classify the antibiotics. We have seen. Then what do you mean by narrow therapeutics index? What do you mean by high therapeutic index antibiotics? We have seen that. How there is a resistance to antibiotics, super infection, etc. So these all are the preliminary information regarding the antimicrobial drug therapy. So we have seen this in the last session. So today we are going to start our sulfonamides or sulfur drugs. So we have seen that there are different targets for antimicrobial drugs. So one of the target is nothing but the intermediate metabolites. One of the target for antimicrobial drug is nothing but the inhibition of intermediate metabolism of bacterial cell. हर एक बैक्टीरिया के सेल में मेटाबॉलिज्म जो होता है तो उसका इंटरमीडिएट या फिर इंटरमीडिएट मेटाबोलाइट जो होते हैं उसको इनहिबिट करने वाले ड्रग्स particularly they are also known as anti-metabolite. So this anti-metabolite term you will hear this anti-metabolite term in two chapters. First one is a sulfur drugs and second one is a anti-cancer drugs. So this term is there in a two chapters. Sulfur drugs they are also known as anti-metabolites. Anti-cancer drugs are also there. One of the class of anti-cancer drug is anti-metabolite. So anti-metabolite means what? So whatever metabolism of bacterial cell, बैक्टीरिया को जो मेटाबॉलिज्म होता है उसमें कोई भी एक इंटरमीडिएट मेटाबोलाइट होता है या फिर प्रिकर्सर होता है. So your drug structure and that precursor for metabolism of bacteria. Okay, जो मेटाबॉलिक प्रिकर्सर होता है या फिर मेटाबॉलिक इंटरमीडिएट होता है उसका स्ट्रक्चर और आपके एंटीबायोटिक का स्ट्रक्चर या फिर आपके एंटी कैंसर ड्रग का स्ट्रक्चर. So these two will have a structural similarity in them and they will act as a competitive antagonist of each other. Okay, so these sulfur drugs are nothing but they affect the intermediate metabolism of the bacterial cell. So we'll see it. What are the sulfur drugs? Sulfonamides, these are again antimicrobial drugs. So in 1930, these sulfonamides they emerged. In 1913 में ये sulfonamides आ चुके हैं. So these are again antimicrobial drug containing two functional groups. First one is nothing but the sulfamido group. First one is nothing but the sulfamido group and second one is the amino group. So these are the again antibacterial drugs. They was developed in the 1930s and they are a true antibacterial drug. उसके पहले antibacterial drug ऐसे थे ही नहीं. So there was a, as I told you, there was a, they were using moldy curd. They were using some plants to treat the infectious disease. But after this 1930, there was a synthesis of sulfonamides. Sulfonamides they are known as a true antibacterial drug at that time. And you know that antibacterial drug जो antibacterial drug होते हैं वो बैक्टीरिया के सेल को ही selectively kill करते हैं. So they are cidal to or they inhibit the selectively growth of your bacterial cell only. Why not mammalian cell? So you are taking drug तो आपके सेल भी है वहाँ पे आपके सेल क्यों नहीं इनहिबिट करते? There is a selectivity, there is a little bit difference in the prokaryotic cell and eukaryotic cell. For example, in case of bacterial cell, you will have cell wall, but in case of mammalian cell, you will not have a cell wall. In case of bacteria cannot utilize folic acid, for example. So they cannot utilize already formed folic acid or already available folic acid. They cannot utilize the folic acid which is supplemented from outside conmutation of it. But mammalian cell they can utilize the folic acid which is supplemented from outside. But bacterial cell will not utilize that. So there are difference between bacterial cell and mammalian cell. उसमें डिफरेंस होता है, जैसे सेल वॉल हो गया, देन प्रोसेस ऑफ रेप्लिकेशन ऑफ डीएनए. So different enzymes, like in that bacteria you have DNA polymerase 1, DNA polymerase 2, DNA polymerase 3. But in case of mammalian you will have DNA polymerase alpha, beta, gamma, delta. So there is a difference between each and everything. There are different enzymes in the bacterial cell. There are different enzymes in the mammalian cell. So that's why these antibiotics, they selectively destroy the microorganism. They will not affect your host cell. And that is the main meaning of your antimicrobial drugs. What is antimicrobial drug? Any drug that can kill the, or that can decrease the pathogenic organism which are living and multiplying in your body without affecting your host cell. So that is the true definition of your antimicrobial drug. Now this, so first category is nothing but the sulfonamides. So they were developed in 1930. Okay, they consist of two groups, that is the sulfamido group and amino group. They are both bactericidal as well as they have another effect also, because this sulfonamide structure, they are also present in a different category of drugs. For example, sulfadoxib antibiotic in होते. So sulfonamide structure, it is also found in the like anti-diabetic drugs like metformin, penformin, etc. etc. So anti-diabetic drug, anti-convulsant drugs, some diuretics are also there. So these sulfonamides not only are having your antibacterial action, they also have different therapeutic uses. Okay, so anti-diabetic drug, anti-diuretic drug, diuretic drug, then anti-convulsant drugs. So there are different category of sulfonamides. So they don't have only antibacterial action, they have also other category action. They are also used in the diabetes, sulfonylureas particularly. Then diuretics, in that you have furosemide, torsemide, etc. etc. They are also anticonvulsants, acetazolamide, etc. So sulfonamides, they will have wide variety of actions on the living organism. So sulfonamides, as I have told you, they are known as the first true antibacterial drug because they was affecting bacteria selectively. They will affect the bacteria, they will kill the bacteria, they will not harm your normal mammalian cell. They are nothing but the group, they are nothing but the structure having two groups, amido group, okay, which is known as SO2NH, and this amino group. Now this free amino group is very important for their bactericidal activity. So your sulfonamide drugs should have free amino group. So and अगर उसमें नहीं है free amino group, so at least, so that free amino group will be available in vivo, means if they are a prodrug, यहाँ पे कोई उसका prodrug है, यहाँ पे कोई attachment है, so inside body that bond should be broken down. So inside the body, at least this moiety is very important. Free amino group and SO2NH. So this SO2NH group is known as sulfonamide, sulfamido group, and nitrogen of sulfamido group is named as 1, and nitrogen of amino group, para-amino group, is known as a nitrogen 4. Okay. So depending upon the substitution, they are divided into different types. N1 substituted sulfonamides, N4 substituted sulfonamides, or both N1, N4 substituted sulfonamides. So we'll see that part in a chemistry. Now we'll see only pharmacological point of view. So when these sulfonamides was discovered, they were discovered by accident. So there was one dye known as a proton siltrate. Prontosiltrate, there was a dye. There was a prontosiltrate dye. It consists of a sulfamido and crisonidine structure. Now it was used to control the bacterial infection in the humans. Now later it was observed that the antibacterial action is not because of the this prontosil dye. ये इसकी वजह से नहीं है. So this prontosil dye is broken down inside the body into one chemical known as a sulfanilamide. Now this sulfanilamide is responsible for the antimicrobial activity. तो ये जो protonsil red dye है, that is a prodrug of your sulfan. Question maybe they may ask the question. So protonsil red is a prodrug. It is broken down into body into sulfanilamide. So sulfanilamide is an active metabolite of protonsil. आप ऐसा बोल सकते हो protonsil red is a prodrug, या फिर आप ऐसे भी बोल सकते हो sulfanilamide is an active metabolite of protonsil red. Now this sulfanilamide released moiety that was responsible for the antimicrobial activity. And after this observation or after this finding, lot of synthetic sulfonamides, they were synthesized and they came into it. So sulfonamides, they are having, this is the structure of your sulfonamides. Now we'll see their mechanism of action, their adverse effect, their indication. So sulfonamides. So nowadays sulfonamides, they are no more used only one drug is used known as a cotrimoxazole. Cotrimoxazole. So that is again a combination of sulfanilamide plus trimethoprim. So that is only drug available from this category. Rest of the drugs they are no more used because a lot of new antibiotics are available for the treatment of infections, and these sulfonamides also have certain adverse effects. So they are no more used nowadays. Only cotrimoxazole is used for certain conditions. So this is the structure. Now you can see sulfanilamide. So this was the active moiety. So NH2 benzene and SO2 NH group. So you can see this is a sulfonamide structure, and there is a one intermediate metabolite which is required for synthesis of folic acid in the bacterial cell. So para-amino benzoic acid. It is called as a PABA, para-amino benzoic acid. You can see structural similarity is there between your sulfa drug and para-amino benzoic acid. जो para-amino benzoic acid होता है वो बहुत ही important होता है bacterial cell के लिए. So that para-amino benzoic acid it will combine with the pteridine ring, and then it will be synthesized. The bacteria will synthesize the dihydrofolic acid. Then dihydrofolic acid will be converted to tetrahydrofolic acid, and then that is useful in the there is active form of folic acid that is useful in the transfer of one carbon atom chain to synthesize the purines and pyrimidines and then DNA. So it is very important for replication that bacteria should synthesize the folic acid. For that folic acid they need a precursor that is known as a para-amino benzoic acid. Precursor is a para-amino benzoic acid. Now होता क्या है कि precursor जो है para-amino benzoic acid और आपका जो सल्फर ड्रग्स है, so they have similar structure. So in place of para-amino benzoic acid वो sulfonamide वहाँ पे जाके बैठे, and because of that false precursor what will happen, they will be not able to synthesize the folic acid. That's how they will act. So summary of mechanism of action of so this para-amino benzoic acid which is an essential precursor for synthesis of folic acid. इसकी बजाय folic see bacterial cell they are not able to utilize pre-formed folic acid or whatever folic acid is supplied in the medium or from the whatever supplied from the external environment. So mammalian cell जो होते हैं अपने वो folic acid का utilization कर सकते हैं. जो ऑलरेडी फॉर्म्ड फॉलिक एसिड होता है वो यूटिलाइज कर देते हैं मैमलियन सेल, लेकिन ये बैक्टीरियल सेल जो होता है वो जो ऑलरेडी फॉर्म्ड फॉलिक एसिड है उसको यूज नहीं कर सकते. तो दे हैव टू सिंथेसाइज देयर ओन फॉलिक एसिड particularly bacteria, and that's why they need a precursor for that. The precursor is nothing but the para-amino benzoic acid, para-amino benzoic acid plus pteridine. So this para-amino benzoic acid plus pteridine they combine together and there is a synthesis of dihydrofolic acid. Dihydrofolic acid that is done by enzyme dihydroteroid synthesis. Okay, dihydroteroid synthesis. It is also known as a folic acid synthesis. So para-amino benzoic acid plus pteridine ring, pteridine they will combine together to form a dihydrofolic acid by enzyme folate synthesis or dihydroteroid synthesis. Then this dihydrofolic acid is converted into tetrahydrofolic acid by folic acid reductase, or dihydrofolate reductase. Okay, so you can see you can say folic acid synthesis, folic acid reductase, या फिर आप dihydroteroid synthesis बोलो या फिर dihydrofolate reductase, same thing. Once tetrahydrofolic acid is formed inside the bacterial cell, so it is utilized for different reactions and synthesis of purines and pyrimidines, and then after that there will be DNA synthesis. That means this para-amino benzoic acid is very important component for synthesis of folic acid for the bacteria. Now humans में क्या होता है कि humans में human mammalian cell they can utilize our already formed folic acid. So that's why these sulfur drugs they will not affect the human cell. They will only selectively inhibit they will selectively stop the growth of bacteria, not mammalian cell. That's why they have selectivity. They are highly selective. So remember this is the normal step normally how there is synthesis of folic acid in the bacterial cell. Now these now these sulfonamides they inhibit the synthesis of folic acid. Okay? They inhibit the synthesis of bacterial folic acid by blocking the enzyme known as a dihydroteroid synthesis. Okay? So whatever sulfur drugs are there, so they block this step. Sulfonamides they are nothing but the competitive. Okay, they will have a structure similar to PABA. जैसे सल्फोनामाइड है, पावा है, दोनों का स्ट्रक्चर सेम होता है. So instead of PABA, instead of paramonobenzoic acid, sulfonamide will be utilized to synthesize this dihydrophilic acid, which is a false precursor. Okay, and then there will be no synthesis of your dihydrophilic acid. So they are nothing but they inhibit this enzyme, dihydroterroid synthesis. So sulfur drugs, they are inhibitor of dihydroterroid synthesis, or you can say sulfonamide inhibit the folic acid synthesis. Then there is another drug known as a trimethoprim from same category. So that trimethoprim affect the, or they will prevent the, they will inhibit this enzyme dihydrofolate reductase. So sequentially dihydrofolate dihydrofolate synthetase is inhibited by sulfonamides, and this trimethoprim inhibit this dihydrofolate reductase. So sequential block of folic acid synthesis is done by these two drugs. Sequential block of folic acid synthesis of bacterial cell is done by these two drugs. तो सल्फर ड्रग का ये मैकेनिज्म है, they will inhibit the dihydroteroid synthetase inhibition. Okay, or they are they are a reversible inhibitor of this dihydroteroid synthetase. Because reversible क्यों है? Because यहाँ पे दोनों स्ट्रक्चर में क्या है, सिमिलरिटी है, और जिसका कॉन्सेंट्रेशन ज़्यादा हो जाएगा उसका एक्टिविटी बढ़ेगा. मतलब अगर आपका सल्फर ड्रग भी है और पाबा भी है, यहाँ पे सल्फर ड्रग है, यहाँ पे पाबा है, सो जिसका ज़्यादा कॉन्सेंट्रेशन होगा वो यूटिलाइज हो जाएगा. So if you increase the concentration of PABA, paramonobutyric acid, or paramonobenzoic acid, so then sulfonamides will be ineffective because of the increased concentration. So that's why it is a competitive type of, you might have seen in the biochemistry, competitive inhibition, non-competitive inhibition. So they will compete with each other for the dihydroteroid synthetase enzyme. So that's how sulfonamides will act. We'll see in the detail. Now trimethoprim is also another drug, so it will inhibit this enzyme dihydrofolate reductase. So there is a sequential block of folic acid synthesis of the bacterial cell, and this combination of sulfamethoxazole from sulfonamides में एक ड्रग आता है sulfamethoxazole. Okay, combination of sulfamethoxazole from sulfonamides and trimethoprim, combination of sulfamethoxazole plus trimethoprim known as a cotrimazole. Okay, known as a cotrimazole. It is an example of synergistic effect. क्वेश्चन इसके ऊपर भी आता है कि combination of cotrimazole plus this trimethoprim, they will act via, ऑप्शन में आएगा synergistically, summation effect, additive effect. Okay, so they will act by synergistic effect. See, okay, now classification of sulfur drugs, classification of sulfonamides. तो sulfonamides के drugs में बहुत सारा classes, मतलब बहुत सारे drugs है, तो उसमें they have divided into different types depending upon their kinetics, depending upon their use, etc. So for example, so drugs used for systemic infection means those drugs which are used for, which are given by oral route or different route for a systemic infection. Okay, so in that also depending upon the kinetics, depending upon the T half of it. So short acting sulfur drugs, intermediate acting sulfur drug, and long acting. क्वेश्चन इसके ऊपर आता है. What are the short acting? Remember, sulfadiazine, then sulfadimidine, sulfacetamide, and sulfamethoxazole. Sulfadiazine, sulfadimidine, sulfacetamide, and sulfamethoxazole. These are the short acting. Intermediate acting. So remember, sulfamethoxazole is an intermediate acting. Then long acting sulfur drug. So long acting sulfadoxine. इसके ऊपर क्वेश्चन आ चुका है. Longer acting sulfur drug is nothing but the sulfadoxine. Sulfadoxine is there, then sulfa-methylpyridazine, then sulfa-dimethoxine. So these three drugs, remember, long acting sulfur drugs, sulfa-methoxypyridazine, then sulfa-dimethoxine, then sulfadoxine. So these are the long acting. बाकी sulfamethoxazole is a intermediate acting, and then sulfadiazine, sulfadimidine, sulfacetamide, and sulfamethoxazole. These are nothing but the short acting. क्वेश्चन इसके ऊपर आ चुका है. You have to remember the classification. Short acting, intermediate acting. उन सभी दो क्लास याद रखो. तीसरा क्लास आपको ऑटोमेटिक याद हो जाए. ठीक है, जैसे लॉन्ग एक्टिंग में ये ड्रग याद रखो, सल्फोडोक्सिन. जीन जीन जो होता है, जीन वाले जो एक्स आई एन ई, तो दोनों भी क्या है, लॉन्ग एक्टिंग है। जीन लॉन्ग एक्टिंग मतलब सल्फाडोक्सिन प्लस सल्फा डाइमिथोक्सिन, so both are long acting, and this sulfamethoxypyridazine, so this is also, and sulfamethoxazole intermediate acting, बाकी ये सब डिमेडिन, सिटामाइड, okay, sulfadiazine, these are the short acting. These three category drugs, they are used for the systemic infection, मतलब फॉर एग्जांपल ब्रोंकाइटिस, सिस्टमिक इन्फेक्शन, ब्रोंकाइटिस या फिर यूरिनरी ट्रैक्ट इन्फेक्शन, सिस्टमिक इन्फेक्शन, दे आर यूज्ड फॉर systemic infection. Now, those used for GIT, those used in the GIT for the treatment of ulcerative colitis, GIT में locally effect के लिए use करते हैं कौन, सल्फासेलेजिन, क्वेश्चन इसके ऊपर भी आ चुका है. So drug used for the treatment of ulcerative colitis locally in the GIT, that is a sulfasalazine. Sulfasalazine. Now this sulfasalazine is made up from two molecule. ये जो sulfasalazine होता है उसका स्ट्रक्चर में दो मॉलिक्यूल सल्फासेलाजिन, तो इसमें सल्फोनामाइड एक मोइटी होता है और इसमें 5 अमीनो सैलिसिलिक एसिड ये एक मोइटी होता है. So it is made up of two drug. So it is a prodrug, yes, obviously. So in the intestine it will be broken down into two drugs with 5 amino salicylic acid and sulfapyridazine. Okay, these are the two moieties present in the sulfasalazine. Now it is broken down in the intestine by enzyme known as azoreductase by bacteria. बैक्टीरियल एंजाइम होता है एजोरिडक्टेज, वो उसको ब्रेक डाउन करेगा, उसको सल्फासेलेजिन को इनटू टू टू ड्रग. फर्स्ट वन इज नथिंग बट द 5 अमीनो सैलिसिलिक एसिड एंड सेकंड वन इज नथिंग बट द सल्फापेरिडाइजिन. तो सल्फासेलेजिन क्या है, प्रोड्रग है यार, इट इज यूज्ड लोकली फॉर अल्सरेटिव कोलाइटिस. नाउ थर्ड क्लास, topically used sulfur drug, topically used sulfur drugs. So in that case you have different, like for example mepenide is there, then silver sulfadiazine is there, sulfacetamide is there. So out of that, this silver sulfadiazine, it is used for the treatment of burns. Silver sulfadiazine is used for the treatment of burns. So now you might have seen one cream containing silver sulfadiazine. अगर आपको कहीं भी जल गया, so ये silver sulfadiazine क्रीम अभी भी मिलता है. So topically sulfur drugs are available for use, but for systemic infection they are no more used, except cotrimazole is the only drug that can be used. Silver sulfadiazine is used for burn therapy, okay, remember, and it is also used for prophylaxis of burns. Prophylaxis is prevention of further infection. Then sulfacetamide is used as a, it is used for the ocular infection. Sulfacetamide is used for the ocular infection. याद रखो इसको, क्वेश्चन आते हैं इसको. आउट ऑफ दैट सल्फासेटामाइड इज द शॉर्टेस्ट एक्टिंग. सल्फासेटामाइड क्या है, शॉर्टेस्ट एक्टिंग होता है. सिल्वर सल्फाडाइजिन है बर्न्स के लिए. मैकेनिज्म क्या है, वी हैव सीन इन द लास्ट स्लाइड. सल्फोनामाइड्स दे इनहिबिट द फोलिक एसिड सिंथेसिस और डायहाइड्रो, so they inhibit the dihydroteric acid synthesis, they inhibit the folic acid synthesis enzyme or dihydroterate synthesis inhibitor. Sulfonamide inhibits the enzyme folic acid synthesis and which converts the PABA to the folic acid. इसका काम क्या होता है, to convert the para-aminobenzoic acid into folic acid. Inhibition of this enzyme results in the deficiency of folic acid in the bacterial cell that causes the cell injury and there will be no bacterial DNA formation. So injured or disrupted cell, they can be easily phagocytosized by our defense system. That's how they will act. Now sulfur drugs, they are ineffective in case of pus. The reason क्या होता है देखो, they are ineffective in case of pus. pus मतलब आपको अगर जख्म हो गया तो उसके उसमें जो white fluid जमा होता है बाद में, उसको pus बोलते हैं. So sulfonamides, they are ineffective in case of pus and tissue breakdown products, because in that case in the pus there is a high amount of power, because pus is a having high amount of power. So sulfonamides, they are ineffective in case of pus or tissue breakdown product, because that product of tissue breakdown or pus consists of a large amount of PABA, para-aminobenzoic acid, and I have told you in a very first slide that sulfonamides, they are nothing but they are having similar structure to PABA. जिसका स्ट्रक्चर, जिसका अमाउंट ज्यादा रहेगा वो काम करेगा, ठीक है. दे आर हैविंग स्ट्रक्चरल सिमिलरिटी, दैट्स व्हाई दे आर नोन एज अ anti-metabolite. So it is also known as the Woods fields theory. There is a sulfonamides, they are ineffective in case of Woods fields theory. Now it is not applicable for the mepenide. Mepenide जो drug होता है, so it comes under the sulfonamide drug, but it will not have structural similarity to the sulfonamides. ये जो mepenide होता है, एक mepenide नाम का drug है, mepenide. So it will not have sulfanilamide in their structure, but still it invade the same enzyme, that is folic acid enzyme. Sulfonamide का resistance भी होता है. As I have told you, sulfonamides they are no more used. They are resistance. Okay, initially these organisms was sensitive to the sulfonamides, and okay, after the certain time span, these microorganisms developed the resistance to the sulfonamides. ठीक है, ये स्टेफिलोकोका है, स्ट्रेप्टोकोका है, न्यूमोकोका है, मेनिंजोकोका है, ठीक है, गोनोकोका है, ई कोलाई, they acquired a resistance to the sulfonamide. So initially these bacteria was sensitive, but after a time span they develop a resistance. Now resistance develop होगा, उसका mechanism होता है. So they developed a resistance by different way. So certain drugs, certain bacteria develop the resistance by plasmid mediated gene transfer. Certain bacteria developed the resistance by uh, by developing the ability to utilize the folic acid, already formed folic acid. Some bacteria developed the resistance to the sulfur drugs. So by making changes in the DNA, and then by synthesizing a enzyme, that is a dihydrofolate synthase, which is having less sensitivity to the sulfonamides. There are different mechanisms to develop a resistance. तो पहले तो अभी, that's why nowadays these are not used, because they are, most of bacteria they are resistant to sulfur drugs. And we have better options like penicillins are there, cephalosporins are there, macrolides, okay, then tetracyclines, amino acids. Lot of drugs are there. So you can see over here again mechanism. So it is a mechanism of bacterial folic acid synthesis. Bacterial folic acid synthesis. तो डाइट में क्या होगा, प्रिकर्सर होगा, कौन सा, पाबा, पैरा अमीनो ब्यूटरिक एसिड. So from the diet you will get a precursor, bacteria will get a precursor known as a PABA. Okay, now from the PABA, dihydrofolic acid, that is synthesized. Dihydrofolic acid is a synthesizer. The folic acid synthetase enzyme, or it is also known as a dihydroteroid synthetase. Synthetase or dihydroteroid synthetase. Now after that, dihydrofolic acid will be converted into tetrahydrofolic acid by another enzyme known as a folic acid reductase or dihydroteroid reductase. Okay. Then this tetrahydrofolic acid, it will synthesize the purines bases and all that, and after that there is a synthesis of DNA. So this PABA is very important for synthesis of genetic material in the bacteria. Now बोलेंगे अभी यहाँ पे mammalian cell का कैसा. So whatever PABA you are getting from diet, that will be converted into DNA, that will be converted to folic acid, no doubt. But our mammalian cell will also have another mechanism, that if such is that PABA is not there, our host cell can utilize already formed folic acid. तो आपको बार्स मेडिसिन से या फिर विटामिन जो होता है आपका इसमें टेबल्स में या फिर सिरल्स में, so that our mammalian cell can utilize already formed folic acid. That's why these sulfur drugs, they will not affect the host cell, they will only selectively affect the bacterial cell. Now this folic acid synthetase, this enzyme is blocked by sulfonamides. Sulfonamides, dapsone, methotrexate, proguanil, trimethoprim. Okay, these they will block or they will inhibit this folic acid synthetase. Now this trimethoprim is another drug. It is a pyrimidine derivative. Trimethoprim. So it will inhibit this enzyme, folic acid reductase. Now if you combine the sulfonamides and trimethoprim together, so if you use sulfonamide individually, so bacteria may develop resistance. Okay, already a lot of bacteria has developed resistance. If you use trimethoprim separately, they develop the resistance. But you combine trimethoprim with the sulfonamides. Okay, so at that time, because of the sequential block of acid synthesis in the bacterial cell, These two drugs, that is sulfamethoxazole particularly, sulfamethoxazole and trimethoprim. They together they are known as a cotrimoxazole. Cotrimoxazole. Now that cotrimoxazole selectively inhibit the sequentially inhibit the synthesis of folic acid in the bacteria, and it will exert cidal effect. So, resistant to sulfonamides if they are used alone is there. Resistant to trimethoprim if it is used alone is there. When these two together they are combined in a cotrimazole, bacteria will not have a resistance. Bacteria will die. So, and the combination of these two, methoxazole and trimethoprim, known as a cotrimazole, in a 5:1 DHFMS, DHFMS dihydrofolate acid with THFMS tetrahydrofolic acid. Pharmacological actions of sulfur drugs. They are mainly used as a bacteriostatic, but they can be bactericidal in the higher concentration. Primarily वो bacteriostatic होता है. What do you mean bacteriostatic? Those any agent that can inhibit the growth of bacteria, known as a bacteriostatic. And what is meant by bactericidal? Any agent or any drug that can kill the bacteria, known as a bactericidal. Cidal मतलब killing effect होता है यहाँ पे, और static मतलब inhibition of growth. Okay? Bacteriostatic means growth inhibitor. Bactericidal means killer. Okay? So they are mainly bacteriostatic in nature, but they can be bactericidal in higher concentration. And most of them were used for the UTI, urinary tract infection, then RTI, respiratory tract infection. Spectrum of activity. Spectrum of activity मतलब वो कौन से organism के अगेंस्ट में इफेक्टिव है. Spectrum of activity means what are the list of organisms which are susceptible for the sulfur drugs. So sulfur drugs they are effective against the variety of organism. They were effective. अभी तो नहीं है लेकिन पहले थे. So sulfur drugs were effective against these organisms. Particularly gram-positive organism and gram-negative organism. Okay, like chlamydia, then streptococci, pneumococci, gonococci, and meningococci. This organism was sensitive to the sulfur drugs the previous year. Nowadays they have developed the resistance. So then Clostridia, this Clostridia bacillus anthracis, popular species, they are also sensitive. So अभी भी bacillus anthracis is sensitive to the sulfur drugs, and that's why sulfur drugs are of choice in case of anthrax. Okay? Sulfur drugs are drug of choice in case of treatment of anthrax. Sulfur drugs also somewhat effective in case of malarial parasite. This is a spectrum of activity. So you can see a lot of organisms they were sensitive. So you can call them as a broad spectrum antibacterial drug. Okay? Narrow spectrum मतलब क्या? Narrow spectrum is those drugs which will have activity against a certain kind of pathogen. Like for example, penicillins they are known as a narrow spectrum because they will only kill the gram positive bacteria. That is a narrow spectrum. Now, what is meant by wide spectrum or broad spectrum? So anything that any drug if it is able to kill a variety of bacteria like bacteria, gram-positive, gram-negative, fungus, or other kind of bacteria, that is known as a broad spectrum antibiotic. Okay. Absorption, distribution, metabolism, elimination of these sulfur drugs. Sulfur drugs they are almost completely absorbed from the intestine. After absorption, 50% of sulfur drugs they bounce to plasma protein, particularly albumin. Particularly albumin. They are protein binding in nature. They are having binding capacity. So there might be distribution interaction, which are possible with the other drugs like warfarin and all that. Okay. So the bound sulfonamide has less bacteriostatic. ये तो पहले लेक्चर में बोला मैंने. So any drug if it is bound to plasma protein, so the drug is not available for pharmacological action. The drug is not available for elimination. The drug is not available for metabolism. So if drug is bound to a plasma protein or tissue protein, so that is not available for pharmacological action. That is not available for metabolism. That is not available for elimination. Okay. So these sulfur drugs they are almost completely absorbed from GIT. 50% of sulfur drugs they used to bind to the plasma protein, particularly albumin. There might be drug distribution interaction, particularly with warfarin. Warfarin के साथ में अगर देंगे तो distribution interaction हो सकता है. Highly protein bound drug not so effective in the treatment of acute infection. Highly protein bound sulfur drugs they are not much effective in case of acute infection because their action is prolonged. What is the metabolism? liver they are metabolized. Okay, so what is the major pathway for metabolism of the sulfur drug? So it is biotransport. Okay, acetylation reaction. So sulfur drugs are metabolized by acetylation reaction, which is a phase second reaction. यहाँ पर आपको फेज फर्स्ट में आता है आपको ऑक्सीडेशन रिडक्शन हाइड्रोलिसिस. फेज सेकंड में क्या आता है मेटाबॉलिक रिएक्शन में ग्लूकोयूराइड कॉन्जुगेशन, ग्लूटाथाइन कॉन्जुगेशन, सल्फेट कॉन्जुगेशन, एसिटाइलेशन कॉन्जुगेशन और the amino acid conjugation. So acetylation is phase second metabolism. So these drugs they are metabolized in the liver by phase 2 metabolism, that is the acetylation. And you know that the acetylation, so whatever the gene that controls the enzyme acetylase, okay, so it is varied from person to person. Genetic polymorphism. तो यहाँ पे स्लो एस्टाइलेटर्स होंगे या फिर रैपिड एस्टाइलेटर्स होंगे. तो सल्फर ड्रग दे आर मेटाबोलाइज्ड बाय एस्टाइलेशन ऑफ नाइट्रोजन ऑफ पैरा अमीनो ग्रुप. जो पैरा अमीनो ग्रुप है वहाँ पे एस्टाइल ग्रुप आ जाए. डिपेंडिंग अपॉन द कैपेसिटी ऑफ इंडिविजुअल, so there may be rapid astylators and slow astylators. Most of the time, rapid astylators are there. Slow astylators are there. There is a 40-53%. Now, in case of rapid astylators, you have to increase the dose of drug. वो जल्दी मेटाबोलाइज करते हैं ड्रग का, उसमें डोज ज़्यादा देना है. जो स्लो एस्टाइलेटर होते हैं उसमें डोज कम करना है. They used to ask question on this point. This acetylated forms of sulfur drugs, they are ineffective, they are not effective, and they have a toxic potential of parent drug. Means वो acetylated metabolite जो होता है वो antibacterial नहीं होता है and also has a toxic effect of parent drug. And also acetylated metabolite of this sulfur drug is a highly soluble in the acidic environment. Acidic environment में क्या होता है, poorly soluble होता है. So because of that poor solubility of acetylated metabolite, they get deposited into the your kidney and causes crystal urea. Okay, so crystal urea is the adverse effect of your sulfonamides. It's particularly because of the acetylated metabolite. So acetylated metabolite जो होता है sulfonamide का, that is has a poor solubility in the water and acidic urine. Acidic urine में और water में उसका solubility नहीं होता है. That's why that crystal get deposited in the nephrons, known as a crystal urea. So you can decrease the formation of crystal or you can increase the excretion of sulfur drugs by alkalization of urine. Alkalization of urine. So urine को alkalize करो by using sodium carbonate, sodium bicarbonate. Using alkalization of urine, you can increase the solubility of the acetylated metabolites. So acetylated form of your sulfur drugs, they have less solubility in the water as well as acidic urine. Because of that, they get crystallized in the urine, okay? And they get deposited in the nephrons and kidney, known as a crystal urea. If you want to remove that, you can either increase the formation of acetylated metabolite or you have to increase the removal of that metabolite. You cannot decrease the formation, so you have to remove that. Okay. So how you can remove? By doing alkalization of urine, by increasing the pH of urine. pH एसिडिक अगर है तो वहाँ पे वो क्रिस्टल बनाएगा. अगर pH बेसिक है तो वो उसमें soluble होता है. So you have to increase the urine pH. So urinary alkalizers are used. Again, what are the adverse effects of this sulfur drug? Sulfur drug के adverse effect क्या है? Adverse effect of sulfur drugs. Very simple. It is very simple. Adverse effect of sulfur drug. Different kind of adverse effect. They may cause allergic reaction. Skin allergic reaction. So allergic reactions like fever, skin rash, eosinophilia, exfoliative dermatitis. मतलब आपके स्किन के ऊपर एक्सफोलिएशन हो गया, स्किन आपकी निकल जाएगी. fever, skin rash, eosinophilia, exfoliative dermatitis. Main adverse effect, Stevenson-Johnson syndrome. You have to remember Stevenson-Johnson syndrome. Stevenson-Johnson syndrome. It is a severe form of dermatitis. अगर dermatitis ज़्यादा हो गया तो उसको बोलेंगे Stevenson-Johnson syndrome. So with widespread lesions on the skin and mucous membrane. तो ज़्यादा ही उसका यहाँ पे inflammation करेगा. That is known as Stevenson-Johnson syndrome. Particularly with the longer acting sulfur drugs. Stevenson-Johnson syndrome is an adverse effect of your sulfur drug. याद रखो उसको. Allergic reaction करेगा skin के ऊपर. Stevenson-Johnson syndrome is there. Again, it will cause hemolysis. it can cause hemolysis. We'll see in the next. So on the GIT के ऊपर क्या करेगा? Obviously nausea, vomiting, diarrhea, जो भी disturbance of gut flora, because it cannot discriminate the useful bacteria and pathogenic bacteria. Antibiotic मतलब कौन सा भी antibiotic ले लो, so it cannot differentiate between useful bacteria and useless bacteria. पैथोजेनिक बैक्टीरिया होता है और आपके कुछ यूजफुल बैक्टीरिया होते हैं जिससे जीआईटी में होता है. नो एंटीबायोटिक कैन डिफरेंशिएट बिटवीन यूजफुल बैक्टीरिया एंड pathogenic bacteria. So they used to kill both pathogenic as well as our helping bacteria. So that's why always after antimicrobial therapy, they used to give you vitamins or probiotics or prebiotics. Okay, तो हर एक सक्सेसफुल एंटीबायोटिक थेरेपी के बाद में आपको विटामिन्स का सप्लीमेंट देते हैं. क्यों? बिकॉज आपके जीआईडी के बैक्टीरिया मर चुके ड्यू टू द एंटीबैक्टीरियल थेरेपी. renal toxicity मतलब दे वही है ना, same we have seen in the previous slide. But in case of acidic urine, the acetylated metabolite of your sulfators, they gets precipitated and causes irritation collecting urine. Sometimes their precipitation or they form a crystals known as a crystal urea. Cause inflammation of kidney, cause crystal urea. Albumin urea means presence of albumin in your urine. Hematuria means presence of blood in the urine. So alkalization of urine, it can decrease the crystal urea. It can minimize the crystal urea. Sulfoxyzole, isoxazole metabolite is soluble in the urine. So most of the जो metabolite होते हैं acetylated metabolite, that is a non-soluble, that is a less soluble in the acidic urine. But there is one drug, sulfa-isoxazole. So its metabolite is soluble in the acidic urine, and because of this, sulfa-isoxazole has a minimum risk of urea. इसके ऊपर भी आपको आ सकता है. Sulfonamide will have least risk of crystal urea. So sulfa-isoxazole will have less risk of causing crystal urea. Hematopoietic blood के ऊपर क्या toxicity होगा? So obviously is a basic drug. Okay, this sulfa drug. They can cause granulocytosis, cytopenia. They can break down your RBC. They can break down your hemolysis. They can cause hemolysis or break down your RBC. They are a strong oxidant. Those drugs which are a strong oxidant, they are given in the patient with glucose 6-phosphate dehydrogenase deficiency. जिन भी पेशेंट में ग्लूकोज 6-phosphate dehydrogenase एंजाइम डेफिशिएंट है, उसमें अगर कोई ऑक्सीडेंट ड्रग देंगे, ऑक्सीडेशन करता है, so it will cause hemolysis, it will break down the blood. Say for example sulfur drug जो है, that is also one of the oxidant. Then another example, primaquine is a antimalarial drug that also causes the hemolysis in the patient with glucose 6-phosphate dehydrogenase deficiency. Toxicity on the hemopoietics. Okay, then toxicity is there. Another adverse effect is there, known as a bilirubin metabolism. Affect the bilirubin metabolism. Bilirubin is nothing but the bile salt. Okay, bile acid. Bilirubin. Okay, sulfonamides they compete with the serum bilirubin for the albumin binding site. It causes the dust. क्या है connectors? I will explain. So what happens if a pregnant woman takes this sulfatux, or pregnant woman is prescribed with the sulfatux? What happens? As you know, this sulfatux they binds to albumin, and this bilirubin also binds to albumin. Albumin को bind करके ही चलता है. Now sulfonamides has a more affinity to the albumin than bilirubin. तो sulfatux देंगे तो वो bilirubin को हटा देगा वहाँ से. Bilirubin level of your blood will be increasing. You will suffering from jaundice. Okay, now particularly in the children's, so pregnant woman में अगर यूज करेंगे उसको, तो वो जो बच्चा है उसके bilirubin known as a kernicterus abnormal increase in the bilirubin level, nothing but the kernicterus. So you have to remember the adverse effect. उसके ऊपर क्वेश्चन आता है, आपका क्रिस्टल यूरिया हो गया, स्टीवनसन जॉनसन सिंड्रोम हो गया, and connectors. At least you have to remember these three. Connectors in the children's, this hemolysis in glucose 6-phosphate dehydrogenase deficiency patients, crystal urea, then Stevenson-Johnson syndrome. These are the main adverse effects you have to remember. Now, what are the therapeutic uses of this drug? It is used to treat the urinary tract infection UTI. जब आप यूरिनेशन करते हो तो आपको एक इंटेंस बर्निंग सेंसेशन होता है, that is due to urinary tract infection, that is known as UTI. So UTI में इसको यूज करते हैं पहले. Nowadays it is not used. Fluoroquinolones antibiotics, they are almost replaced these sulfur drugs. So they are used in the urinary tract infection. Okay, then meningococcal infection, ulcerative colitis. Obviously, ulcerative colitis में उसका भी use है. Sulfasalazine. Sulfasalazine is used in the ulcerative colitis and irritable bowel syndrome (IBD). Also used in the Crohn's disease. Sulfonamides should not be used to treat the established streptococcal pharyngitis. स्ट्रेप्टोकोकल का इन्फेक्शन अगर है रेस्पिरेटरी ट्रैक्ट में तो उसको यूज नहीं करना है, because they have resistance. Streptococcus has a resistance to the sulfur drugs. Again, in case of malaria also, one combination is used known as sulfadoxine plus pyrimethamine. मलेरिया के ट्रीटमेंट के लिए भी एक कॉम्बिनेशन यूज करते हैं, sulfadoxine plus pyrimethamine. यहाँ पे याद रखो sulfadoxine is a longer acting. Drug interaction, so obviously drug interaction. So sulfonylureas anti-diabetics, they get displaced from the binding sites. Sulfonylureas जो होता है, that is also sulfur drugs, that is anti-diabetic drug. So अगर anti-diabetic drug sulfonylureas दिया है और आपका mites लिया है तो उसमें displacement reaction हो जाएगा and possible hypoglycemia. This sulfonylureas will be displaced from their binding site of protein by sulfur drugs, and you may suffer from hypoglycemia. Hypoglycemia is because of the excessive sulfonylureas available in the blood, so that will cause hypoglycemia. So as a drug interaction with the anticoagulant like warfarin, anticonvulsant drugs, due to displacement type of reactions in the protein binding site. Other drugs like Esic anti-inflammatory drugs, this is the activity of sulfonamides by displacing them from binding site. Similarly, आपको phenylbutazone, it will displace the sulfonamides from protein binding site. So it will increase that. Individual drug, sulfasalazine. Sulfasalazine is composed of two molecules, pyridine and 5-amino salicylic acid. So sulfasalazine जो है, it is a prodrug. Is made from two different moieties. इसमें दो स्ट्रक्चर होता है, sulfapyridazine and 5-amino salicylic acid. So it is a prodrug. It is broken down by one enzyme known as azoreductase by intestinal bacteria. ये sulfasalazine क्या है? It is used in the irritable bowel disease. ये IBD में यूज करते हैं. तो इसको देने के बाद इंटेस्टाइन में जाके ये ब्रेक होता है. Sulfapyridine will act as an antibacterial drug and 5-amino salicylic acid will act as an anti-inflammatory drug. That's why this sulfasalazine is having antibacterial activity also and inflammatory activity. Next important point is cotrimazole. I already asked question on this. GPAT में इसके ऊपर question आ चुका है. Cotrimazole. What is it? It is nothing but it is a synergistic combination of sulfamethoxazole and trimethoprim. It is a combination of sulfamethoxazole, that is a sulfonamide drug, sulfamethoxazole, and trimethoprim. It is a pyridine. So combination of sulfamethoxazole and trimethoprim in a 5:1 proportion. That is a 400 milligram of sulfamethoxazole and 80 milligram of your trimethoprim. ये combination याद रखो, क्वेश्चन आ चुका है GPAT 2020. For trimoxazole. Trimoxazole is nothing but the combination. Trimoxazole is nothing but the combination of sulfur drug, that is a sulfamethoxazole and trimethoprim in a 5:1 ratio. That is, if there is a 400 milligram of sulfamethoxazole, 80 milligram of trimethoprim. So 480 ये combination याद रखो, as it is question was there in GPAT 2020. Now what is the mechanism? इसका mechanism क्या है? obviously the sequential block of this of folic acid. So this sulfur drug, sulfomethoxazole, will block the dihydrotauroate synthase. And this trimethoprim will inhibit the dihydrofolate reductase. So sequential block of formation of folic acid. Adverse effect क्या रहेंगे इसके? So obviously adverse effect of parent drugs. जो ट्राइमेथोप्रिम के adverse effect वो रहेंगे, प्लस जो सल्फर ड्रग के होते हैं इफेक्ट वो भी रहेंगे. सल्फर ड्रग के आपने देखा है, due to sulfonamide component it may cause above like crystalluria, then hemolysis, okay, then Stevenson-Johnson syndrome, okay, then GIT disturbances, etc. Due to trimethoprim component, it can cause nausea, vomiting, rash, ascites, and then anemia, leukopenia, thrombocythemia, and aplastic anemia. A combination of these, that is a cotrimoxazole, should be avoided in the pregnancy. Pregnancy में avoid करना चाहिए, pregnant woman में देना नहीं. Combination should be avoided in the pregnant woman. It can cause teratogenicity. GPAT 2020 में combination of this sulfomethoxazole and trimethoprim, that is nothing but the cotrimoxazole, that should be avoided in the pregnancy because they can cause teratogenicity. Particularly this trimethoprim can cause aplastic anemia. What is the use? So this cotrimoxazole is used in the treatment of UTI, urinary tract infection, then infection of prostate gland, known as a prostatitis. Is the drug therapy of choice. Then respiratory tract infection, then bronchitis, sinusitis, then otitis media, infection of ear, GIT infection like sigilosis or diarrhea due to sigilosis, E. coli, etc. Then it is also used in typhoid fever and some STDs, sexually transmitted disease. These are the uses of your cotrimoxazole. You can see the mechanism of this cotrimoxazole. There is sequential block of formation of folic acid. So pteridine precursor, pteridine इसको pteridine बोलते हैं, P silent, pteridine plus PABA. These two will be combined and there will be synthesis of dihydrofolic acid by enzyme dihydrotauroate synthetase, or is also known as a folic acid synthase, that will be inhibited by sulfomethoxazole first, and this dihydrofolic acid is then converted to tetrahydrofolic acid by this dihydrofolate reductase, that is inhibited by trimethoprim. So there is a sequential block of synthesis of your folic acid of bacteria, okay, in by the cotrimoxazole. 5:1 क्या है उसका proportion होता है 5:1. So 400 mg sulfomethoxazole and 80 mg trimethoprim, ये combination यहाँ पर portion आ चुका है. You can see short classification of sulfur acting. So short acting कौन है? sulfadiazine. Intermediate acting sulfomethoxazole. Long acting कौन है? sulfodoxine and sulfomethoxypyrazine. Purpose sulfur drugs. Sulfacetamide sodium is known as a ocular antibiotic. Sulfasalazine is used for the GIT infection. Sulfasalazine is used for the GIT infection and ulcerative colitis. Okay. Then silver sulfadiazine. Silver sulfadiazine is used for the burn therapy and prophylaxis of burn therapy. Mepanide is used along with the combination of other combinations for treatment of malaria and